was the most likely location of the lesion responsible for the patient? Fortunately, the man since the clinic with current episodes of epigastric pain and heartburn. He's tried over-the-counter antacids and PPI. Which multiple of diarrhea, 5-pound weight loss. Okay. Physical examination unremarkable. Real serum gastrin level significantly elevated. What is the most likely location? Gastrin. Where's gastrin made? Gastrin's not made in pancreas.
What's the diagnosis?
I think he has an ulcer here. 5-pound weight loss though. It could be diarrhea. Could be a few different. Maybe I don't know. Epigastric pain and heart. I mean, that sounds like GERD is the first thing. Like he was diagnosed with GERD, but then multiple episodes of diarrhea and weight loss with high levels of gastrin could be a gastrinoma.
Okay, good.
Um,
Okay, I like the gastronoma because you think
yeah.
about this, right? He's already tried PPIs, he's tried
Mm-hmm.
acids, but he's still getting ulcers, has
Mm-hmm.
lots of, gastrin floating around. So,
Mm-hmm.
now they're asking, okay, so what's the
So I
most
don't think it's
likely location?
I don't think it's duodenal wall. I think that'd be the antrum. I'm pretty sure is gastric antrum is where that would come from. Um, I don't think it's pancreatic head or tail. Doesn't seem like it. Epigastric pain and heartburn is not like duodenum is like more of like a peptic, like a duodenal ulcer. Um, ileum, I'm thinking more of like a Crohn's. They're not talking
So I
about
guess my
blood.
question for you is where's the
Yeah.
most likely place the gastronoma can be in?
I would think it's the antrum, but I'm not. Something's antrum's like the upper part of the wall. If I'm thinking of the stomach, I'm thinking of where the antrum is. I think it's there. Like I'm thinking fundus, I'm thinking antrum. Um, yeah, I think so. I mean, I can't remember if those G cells
All
are
right.
there. Do I know
So
wall?
this is
Okay.
kind of interesting here. Let's see kind of gastronoma, what's kind of, I
OZE.
don't actually think this is correct here. I don't.
ZE.
A gastronoma can also be found, but they are less common. Oh, this is interesting. Let's see.
Yeah, and it even says with gastric antrum too, it's like a good choice, but it's just not where gastronomas are found.
Let me look up.
Interesting.
I didn't know this. I thought it's actually pancreatic head because that's the one that we always get tested on. But most common
Let me see.
gastronoma. Let me make sure this is correct because I
Okay.
didn't know this.
Well, I'll look too. I'll look at like USMLE stuff. We'll see what they say. Yeah, their thing. So their USMLE also says ZE syndrome.
Oh, it is. 70% of gastronomas are in the duodenum. I didn't know that. Okay, so interesting. So it's true. So I actually thought they're always located in the pancreatic head, but it says gastronoma is the most commonly found in the duodenal wall, which I didn't know. So
Okay.
that's interesting. So this is Zollinger Ellison. I knew, we both knew the diagnosis. We just didn't know where it's most likely located. But yeah, the most
Okay.
likely location is actually the first part of the duodenum, actually. But really cool. I didn't know that. But learn
But
something
yeah, you're right.
new.
With ZEs too and the gastроnomas, it is the highest yield pancreatic tumor in men one as well. So it's like
Mhm.
that's also a good like pancreatic head's also a good choice there too.
Yeah,
Okay.
yeah. But it
Okay.
says, 60-70% are duodenal wall. So that's interesting. So yeah, something they can
Okay.
definitely test you on because most people, or at least me, if I took the test, I'd say pancreatic head because that's usually on a USMLE
Mm,
standpoint is where they usually ask.
okay.
But I guess, the most common is actually duodenal wall.
Do I know wall? Okay.